Doctor, you mentioned on direct examination your diagnosis of the ear condition of this patient. That is correct. And there were direct smears and cultures from the middle ear secretions, were there not? Well, the tests in the laboratory determined a predominating organism. What was that organism, doctor? It is a common bacterial invader. And what is the name of it? It is an oral furunculosis. That is a staphylococcus of low virulence. Doctor, is it suppurative? It is suppurative. In fact, it is termed otitis media. And doctor, the Diplococcus pneumoniae is the bacteria? Well, it is a staphylococcus, whether albus or aureus. And it is a streptococcus. What other kinds are there? There are several others. Did the spinal fluid examination and blood culture reveal anything? Those tests detect complications such as otitic meningitis or bacteremia. Doctor, what are the terms related to functional tests of cochlear apparatus? Well, there is the audiometry, or measurement of hearing for the purpose of accurately evaluating the extent and nature of hearing impairment. Doctor, you say there is an audiometric test? That is correct, a quantitative measurement of hearing loss. Do the results plot according to an established norm on an audiogram? Yes, they do. That is a graphic representation of a patient's threshold of hearing at different frequencies and intensities. Doctor, what about electrocochleography? Electrocochleography is a new method of testing hearing, particularly in infants 1 to 6 months old. And, doctor, electrodermal audiometry. Electrodermal audiometry is a measurement which detects how the electrical conductivity of the skin is modified by sound. Doctor, what about electroencephalic audiometry? That is a measurement which shows how the electrical activity of the brain is modified by sound. And impedance audiometry? Impedance audiometry is a collective term which describes the various measurements taken with an impedance bridge. Doctor, this patient exhibited maximum compliance, did he not? Well, the procedure measures compliance at air pressure maximum. And the stapedius reflex threshold is what? That is a technique or technical measure for compliance versus sound level in the opposite ear. Doctor, what is a tympanogram? A tympanogram is a procedure which measures compliance versus air pressure. And doctor, speech audiometry was done on this patient? Yes, it was. What was the result? It was a valuable aid in clinical audiology. The patient's functioning in his environment is estimated by a speech discrimination score. And stereo auditory audiometry? Stereo audiometry is a term which refers to audiometric procedures which seek to determine the efficiency of binaural hearing. Doctor, does tone decay enter into the evaluation? Yes, tone decay test is a valuable special auditory test which demonstrates the phenomenon of tone decay. Doctor, what about tuning fork tests? Tuning fork tests means for determining the type of hearing impairment in relation to sound conduction and sound perception. The Rhine test, Schwabach test, and Weber test are commonly used? And is there such a test as a vestibular apparatus test, a caloric test? Yes, there is. What is it? It is a procedure which conveys information of the functional capacity of each labyrinth and the presence of horizontal and rotary nystagmus. Doctor, electronystagmograms are what? Those are records of eye movements by electric tracing induced by caloric or positional stimulation. And finally, doctor, you mentioned in your evaluation the Rumberg test. Yes, the Rumberg test is a procedure which tests body balance when eyes are closed and feet together side by side. Doctor, what is acute or chronic suppurative otitis media? It is a condition which may be followed by intracranial complications such as thrombophlebitis of the lateral sinus, extra or intradural abscesses, labyrinthitis, facial paralysis, and others. Doctor, what is meningitis?
Did you read it?